AskReddit. Doctors of Reddit, what is the most how the fuck did that happen to you case you've seen? Lady with very poorly controlled diabetes and morbidly obese came in via ED with a gaping hole on her thigh, like so deep you could put your whole fist through it. It was oozing ridiculous amount of blood, so much so she had to be transfused. Her blood levels were rock bottom. It transpires she'd accidentally cut herself when trying to wriggle into jeans. Meantime, the wound just kept getting bigger and bigger, and she attempted to just sort it by packing the wound with socks. Single worst thing I've seen. Working in the ER we had some interesting ones, but the simplest and most intriguing one I've had was a man came in complaining about chest and side pains. After a few tests to rule out heart issues, we discovered through an x-ray that the man had 19 fractures throughout his ribcage. When I asked him if he had been doing anything dangerous he replied with nope, just dancing. Needless to say I'd recommend not trying to do leaping flops into the worm on repeat on concrete, which is the only way I can fathom this occurring. And no, he didn't explain what kind of dancing. Well, he sure wasn't doing the safety dance edit. Wow, my first gold, thank you. What a great way to start the day. And removed a word. Old paramedic here. I had a 60s male found on his hands and knees quite dead. He was positioned to receive a dildo mounted to the door lifter on a garage door opener. The track was modified to run the length of a mattress powered by the 1-stroke 2 horsepower opener. He used the remote button to forward and reverse the lifter with a plate adapter for a large rubber dildo. He had taken a massive heart attack. This was years ago. I was near the end of my shift and a patient came in. I can't remember what the triage said, but it would have been something along the lines of self-inflicted laceration to neck. He was put in a room behind a curtain and several of my bosses, all senior docs with like 20 plus years experience, were coming out of the room with the same look on their faces. Sort of like shell-shocked horror. We work in the emergency department, so these people see fucked up shit on a weekly basis, and they all just looked odd. I was thinking, what's the big deal? Obviously he sliced his neck across, but it's not that bad. Then the nurse that was in there was like, oh, ask him to lift his head up. So I did, and all the skin and soft tissue in the front his neck fell down and exposed essentially this. For the love of God, don't Google this link, Jesus Christ. Just a picture from an anatomy book, not bloody, but that's what it looked like, just much redder, and not even actively bleeding. He'd somehow managed to miss all the major veins and arteries. I asked him why he did it and he said it was the right thing to do. I don't think he was on drugs, I think he had mental health problems though. I don't know what happened to him because I went home after that, but I assume he would have gone to surgery and then the psych ward. Training as an EMT, so not a doctor, but in the ER. Old guy shuffles in with his girlfriend, both mid-50s. He is holding a members only jacket in front of his crotch and wobbling in. We take him through triage to the back and get him on the exam table. His scrotum was the size of a large watermelon. It hung below his knees and was easily 18 inches in diameter. Serious hernia issue. Just a big oblong mass of flesh that had overwhelmed the rest of his nethers. I think every physician in the hospital came down to consult on it. I mean everyone. Cardiologists, etc. Everyone made an excuse to come take a look. This was clearly an issue he had been avoiding for years. The prescribed treatment, if I remember properly, was to Kevlar reinforce his belly and shovel his intestines back up and in. They were going to transport him to a nearby hospital for the treatment, but because it was across state lines he refused to go. So he slid off the table, pulled his jeans up around his crotch, grabbed his jacket and his girlfriend and shuffled off to the bus stop. It's an image you never forgot. Closest thing I can relate it to is when Hugh Jackman is trying to carry the fishbowl between his legs in The Prestige. The human capacity to deny the undeniable is amazing. As a radiologist, I've seen an 80-pound ovarian tumor, a hand-sized facial malignancy neglected until it eroded an underlying artery, numerous neglected breast cancers, eroding through the skin dart. People will refuse to see what they really don't want to see. Saw a guy who had a pretty blunt machete lodged perfectly across the middle of his skull, but the angle was unusual and it was like perfectly along, so that caught my attention. Turned out the guy had, unsuccessfully, tried to murder his wife with the machete and later regretted it, so he hit himself in the head with it. He held it with his hand, sharp side front, and gave himself a whack perfectly in the middle of his skull. Thankfully the machete barely made it into the skull, and since it was along the middle it didn't touch any brain tissue. I have an amazing how the fuck did that happen to you story. End of nursing school, did a rotation internship in the large urban hospital. Get a call that the hello is bringing in a 17 years old with a severe spinal injury. Call in the specialty surgeons and they get to work on this kid. He has C3 through C5 fractures from a diving injury. Docs work on him for hours with very little hope that he will regain anything below the neck. Once the surgery is over we are all exhausted, but the surgeon wants to see what will happen if we wake him up. With respiratory standing by we bring him out of anesthesia. He starts breathing on his own. He opens his eyes and responds to his name. Holy shit, awesome. For some reason I was near his hand. I saw a small movement. I said nothing. I grabbed his hand and squeezed. He squeezed me back. Holy fucking shit. Mind you, I'm just a nursing student, but I yelled the surgeon's name and said he just squeezed my hand. Surgeon called bullshit until he saw the kid raise his arm. The entire hall was silent. This kid should have been a quad for life, but by some miracle he was moving. The feeling of seeing that kid's arm move via something that I will never forget. I tried to keep track of his progress, but the last I heard he was killing it at physical therapy and had regained almost total control of his upper body. Just last week I had a guy over 400 pounds, BMI 60. He was a hoarder and kept getting cellulitis in his legs because his house was so cluttered. He kept hitting his legs into things and getting cuts and infections. When he came in we had to remove his socks with scissors because he hadn't taken them off in over 3 months. His socks had embedded into his skin and somehow become one. I didn't learn in medical school how that happens. Had a lady come to the morgue in pieces for several days. She had fallen off a catwalk thing into an industrial fan that had no guards due to cleaning being performed on that area in a factory. They were having trouble finding all of her. It wasn't explained to me until 3 days after the first piece showed up, so I thought there was a serial killer out there for a bit. A PA I work with saw this patient with an external fixator. Normally these are odds and screws outside the body holding a fracture stable until swelling or what have you goes down so they can operate and internally fix the fracture. They're normally on for a few days. Cut to this guy's office where a patient walks in one day with an X-fix on his leg that has been there for 3 fucking years. The guy lived a normal life and just thought it was the way they fixed legs. How he never got an infection I'll never understand. Not my story, but a co-resident's. A farmer from a rural area was using a table saw on a hillside. In the midst of cutting wood to build a shed, he slipped on the hillside and lopped off his penis. How plausible this is, whether he was lying we will never know. Rather than seek medical attention, he takes a castration ring used to stop bleeding from castrated goats he kept on the property and shoved it down around the stump. If that isn't bad enough, he also began to have horrific swelling and decided to use a rabbit water bottle feeder, the kind you see in pet stores, to prop open his urethra so he could pee. He stayed like that for 3 days until he started to have fevers, redness, swelling, etc. due to infection. When he got to the ER, the triage nurse called the urology team. We have pictures. Basically what ended up happening was his urethra was translocated to his perineum so he could still urinate, and his infected, necrotic penis was excised alone with a portion of his scrotum due to the severe cellulitis in the area. He ended up making a full recovery after skin grafting to the area. Work in the ED as a medical student. Had a guy the other day who let a leg infection get worse for years, and when he finally came in his infected leg was at least 4 times the size of the other one and was draining copious amounts of foul smelling pus. If the infection had been seen earlier, he would have just needed antibiotics. Because he waited so long, he's going to lose the leg, if not his life. Not me, but a nurse friend guy comes in complaining of pain sitting down. Pain in his rectal area. She goes to take a look and this man's anus is so infected it was almost gangrenous. The infection wasn't just around the anus, it had traveled inches deep into his body. Literally oozing pus. One nurse had to excuse herself and almost passed out due to the smell, I was told. No idea what caused it or whatever happened to the poor guy. In my discussion tab I made a comment where you can submit your video suggestions. Today's topic got selected by a user named Memalord420. With that suggestion he won a shout out for his Instagram. If you want to get a shout out for any social media or else, simply comment your video idea and have a little luck. Now to today's lucky winner. His Instagram tag is fakeacc4memes420. Anyway, like and subscribe for more Reddit related videos.